Welcome to At the Cameron. My name is Jennifer Claro, and I work as a director at the Cameron Senior Center. And I'm fortunate to be joined with Peggy Siegel, who is a colleague of mine at the Cameron and is co-hosting this show with me today. Peggy and I are just very excited to have Terry Stater with us, who is our veteran service agent as well as our veteran service officer. And he has graciously served this community for 9 years in this position. And Terry has been the principal spokesperson, advocate, providing caring, advocacy, and recognition that our veterans have earned, and we just really appreciate him for all of his service and his genuine care for veterans and this community. So thank you, Terry, for being with us today. Yeah. So Terry, can you kind of tell us what the eligibility is for a veteran?
Well, there's a couple of different ways. A veteran is that person who's basically been on active duty for more than 180 days. That's what we call the federal guideline. So active duty means that you were boot camp and training doesn't necessarily count. So it's military is active duty military. It means you're in one of the branches of the service and you actually were, like I said, active duty for more than 180 days. There's reserve programs, the National Guard and everything else, and they have limits as well, but as far as the time goes, they need to have been deployed. So that means that if they were called up for a policing action or something like that, then they may have been called to active duty. We have had reservists, Air Force reservists here in town that have gone on to, have careers. So anybody that serves on active duty at any point in time is actually considered a veteran. Depends upon how many years they've served or how many months they served, would be eligible for state and federal benefits.
So what could you tell us for, let's say, a spouse or for a veteran's children? What would some of the benefits be that they might not know about?
Well, as far as the veteran status goes, most of the effort is centered around the veteran. But there are some what we call safety net programs that cover spousal and family members as well. So Massachusetts is unique in that we're the only state in the country that actually provides financial resources above and beyond what the VA offers. So that's been around since Revolutionary days, actually, believe it or not. Massachusetts is unique in providing emergency funding for medical bills, for rent arrears, any housing, any kind of situation where a veteran may not have the resources for. So it's emergency funding. It's a form of public assistance, and they apply for it. It's called Chapter Mass General License, or MGL Chapter 115 is the actual law that covers it. But it covers the family members as well. So it could, like I said, could be a real benefit to somebody. Retirees, health care for a service-connected disabled veteran. If they're 100% service-connected, in other words, they have enough, or they are, like I said, 100% service-connected, then family members are included under health care for them. The spouse is automatically. So even the spouse of a deceased veteran could be eligible for Chapter 115 benefits because they're essentially the surviving spouse.
Okay.
What do you think the biggest challenges are for folks that are applying or in touch with you about benefit?
Well, the biggest thing is to come forward with the need, to recognize that if they have an injury, don't assume it's not significant enough. So if an injury that they have at some way or another changes their life or the way of doing things for themselves or the way they interact with people or their family, then they need to come to us so we can file a claim. Don't automatically make this assumption. A lot of people think that you know, if they they've lost a limb or a casualty of some sort of significant bodily harm, that they don't want to take the benefit away from another worthy veteran. And that's not the way the VA works. The VA works and it gets its funding based on the needs of the veteran population. There's no specified budget, so to speak, just for the VA. So the biggest thing is to convince the veterans to seek out what benefits are available to them and to get them. Sometimes it's health care. Sometimes if they have a claim, it may give them hearing aids when they become hearing aid ready, so to speak. It could do neck, back injuries. Any of those kinds of things are all something that they should explore. Let the government tell you no, rather than assume that, oh, I don't have a worthy benefit
And
requirement.
how about psychologically?
Well, mental health has been a real big concern over the last several years. We have heard the 22 a day number brandished around, where 22 veterans a day commit suicide or just can't handle the outside world. So there's been a lot of changes because of the way that that's being recognized. So one of the things we talked about with the fire department here recently is that that the 988 number, the suicide hotline now that's available, has a veteran component to it. So if you dial 988 and then hit 1 after that, it will go to the Veterans Crisis Hotline. Correct. So what we try and do there, and this is not just for the veteran. It's for friends. It's for family members. Yeah. If they have a veteran that they're concerned about, they can call up, because if a veteran has mental health challenges, it usually expands out to their close environment, whether it be friends or family. And it's not always comfortable talking to the veteran about these things. So sometimes you got to get them connected up with the right person, or the right person on the other end, that they can start sharing their experiences. A lot of those experiences may be dealt with by veteran-to-veteran communications, which is important because every veteran has done the same thing, so to speak, whether in what branch of the service. We all started with boot camp and worked our way up into various programs, and didn't matter whether you were in the Army, the Air Force, Marine, or whatever. We all had boot camp, and so there's some common factors. We all got the military language. We all know how to speak to each other because that's what we did. So the mental health side, going back to that, is important for them to be able to want to share. First, they want to be able to share their experiences, and we encourage them to do that. And if they aren't comfortable talking to a non-veteran or non-military person, then there are resources out there, and there are plenty of them here locally. We have some excellent health care facilities here in this area. We have Bedford, Boston, Worcester, the VA side. So mental health is a big issue. Basically, let's get it out there to want to talk about. We have some really good stories about people that have got themselves by that hurdle and started their own businesses and become independent and have been able to deal with their issue and address it.
Thank you.
Just in working with you as a town colleague, and how would someone find you, or how would someone find the Veterans Service office?
Well, that's a good thing. My office is at the Millennium Building, which is the central office for the school system, which is behind Abbott School at 23 Depot. We have a big sign right there in the hallway, so when you walk in the door, there's a big sign that says "Veterans Welcome Here," and it's Since I'm the interim veterans agent at the moment, we're going to be hiring a full-time person. The job hopefully will be posted soon, and what the full-time office hours are there, and we've started off working at Town Hall now on Tuesdays. So Tuesday afternoons from 2 to 6:30 we will be up next to the big meeting room upstairs on the second floor in conference room B, and we take open office hours. We have a web page, you know, the Westford, if you put in westfordma.gov/veterans, you'll come to our veteran services page. We have a lot of resources listed there, so you can do a lot of it on your self-investigation, but we encourage people to make an appointment, come in. I will meet with any veteran any time of the week, any day of the week, you know, Saturday, Sunday, evenings if you want. It doesn't have to be during office hours at all. So it's important for you to understand that it's available to every member of the town of Westford, you know, and family members are also encouraged. If they want to come as an advocate of their veteran, I'm more than welcome that, you know, because it's important for them to at least start tapping the resources that are out there. We can provide a lot of really good information out of that office, you know, and get you started and let you do however you want to approach it, whether you want to look at it yourself or want somebody to tell you how to manage the programs.
Yeah. I was just wondering, being in this position for 9 years and of course being a veteran yourself, what do you think the obstacles are or would be for someone to want to, you know, come to the veterans office? And
yeah.
Do you ever see where certain people think that that their rationale for coming may not be substantial enough? And I know you talked a little bit, it could just be something really small, you know, maybe acclimating into the community or not being, you know, struggling financially, and just need and be embarrassed about it. But you know, there's that assistance there, you know.
Well, we can provide lots of resources. So we're there. I'll just say it's like an open office where you can come in and ask any question you want. So there aren't any dumb questions to ask, and you know, and we've done. It's interesting. I was thinking about some of the things I've done. Somebody came in and they were going off to a job interview, and their tie was all messed up, and they asked me to help them tie their tie. Then I also know that I came in and helped somebody renew their driver's license. They had been stopped, and they had an expired driver's license, and the police officer says, "Well, Veteran Services is over there. You're a vet.
Awesome.
Go over there," and we renewed his driver's license right then and there.
Yeah.
So. And property taxes, you know, people are asking questions. Well, they might understand that there's a benefit for veterans for property taxes. Well, there is. And if you have a service-connected disability, anywhere from 10% to 100%, you get a property tax exemption. And same way with disabled veterans have sales tax exemptions, excise tax exemptions. There's hundreds of benefits that you may not know you have access to. So I'll just say that, you know, you have any questions about how the government can help you, because you helped us by being available as a veteran, as a military service member. You have this eligibility. Tap into it. Find out what's out there. Maybe there isn't. Maybe it doesn't give you what you want, but it can give you something.
Right.
So you know, explore those opportunities. Don't just assume that, oh, since I have all my limbs and all my organs and I've never been shot at, well, that doesn't mean that you didn't have things go on in your life.
Of course.
You know, Flightline, the crews that are working out on the Flightline, whether they had had headphones or noise canceling devices, and maybe they didn't wear them, and now all of a sudden they're 65 and they can't hear their wife or or their spouse, and they have hearing loss, or they're ringing in the ears, tinnitus.
Yeah.
Those things are all benefits that they can get help for, as well as maybe even some financial assistance for. So we encourage you to just come in and ask questions or call. or email.
I've heard you talk about going to bridges, and you come to the senior center, and you're always helping us organize veterans breakfast, and you clearly are like, I'll come morning, day, or night, or weekends. So that level of service is very extraordinary. So that is. I think that's just so important. So
I try and silence my phone after about 11. But otherwise,
Do you?
Yeah, and then again, you can email. It's just, it's out there. It's a one-person office, so there aren't really any boundaries for it. So I want people to ask questions. It may be no, but it might be yes.
Well, and I think another aspect of it is, whether it's yes or no, these resources are available, and you've earned it. You've protected your country. You've allowed us to be able to have the freedoms that we have, and so why not take that little step for yourself?
Right.
And also, you're very welcoming to people when they come. I mean, it's fabulous.
I think that's a part
lovely.
of what the job is to be, encourage people to open up,
Yes.
so that they can talk about things, and don't be afraid to mention every little thing. I tell people, don't just come in and just drop in and have a conversation. Write down notes ahead of time.
Right.
And
ask
write
questions.
down all the questions you have, and come in with a whole list of questions. I'll go through every one of them with you, and we'll look at them. I mean, because when you're sitting there in front of somebody having a conversation like this, you don't always get to talk about everything that's on your mind.
Right.
And you walk out the door 5 minutes later and think about something.
Yeah.
So
Of course.
I always ask people to try and jot things down, or email me any time of the day. And
you're very
let's just do that.
available, so we really appreciate that.
Well, thank you. Yeah.
Well, I was just wondering too, with like the Veterans Affair and local aid. What is like the typical compensation, like monthly compensation for someone from the Veterans Affair? And then could you explain the difference between that and local aid?
Okay, well, first of all, I work for the town of Westford, so I am not with the VA at all. I don't have anything to do with the VA other than being a veteran and a patient at Bedford Hospital, Bedford VA, or a client, or whatever you want to call it. Anyways, so there are two different programs. The VA manages home loans, college GI Bill, national cemeteries, like Bourne.
Yep.
They manage the headstone programs for veterans benefits. Then there's the healthcare side and the compensation side, disability compensation. Those are like 5 different entities, and they all are very unique. The healthcare side doesn't talk to the benefit side unless you get a service-connected rating. Once you do that, then you've earned a whole set of healthcare benefits. Everything from getting your new eyeglasses, whether you have hearing loss or whether you have gout or sleep apnea or whatever, you get hearing aids and glasses for free. If you're getting 10% or better in compensation, which is $175 a month, then you're eligible for all these other health cares, including your prescriptions.
Wow.
Now, you don't get your prescriptions for free, but you might have a copay that's better than what you're paying for with Medicare or something else, or your supplemental health plan. So the VA is a great resource. At the state level, which is the programs that we had managed out of that office under the Chapter 15 and CMR 108, a whole bunch of good numbers, but those are all the legal foundation for how we provide these services. So again, we have 2 sets of benefits, one for the veterans at state level and your local community, as well as what's at the federal level provided by the VA. Again, we have a web page where a lot of those links are at, and you're more than welcome to look at them. And I have booklets and handouts and things like that we can talk about. And I've had plenty of people just come in and ask questions. We'll hand them information. But so financial all I will say is that right now, from the VA side, we have what I think I saw the last set of numbers I saw. We have 250 some people here in the town that are getting benefits from the government every month. So, and that averages $1,500 a month, believe it or not, is what the average recipient here gets. In Westford, from the Chapter 115 benefits, we have given anywhere from, I'll say, we normally average about $14,000 to $15,000 every year, and we've done as high as $90,000 providing financial monthly checks to somebody from the town of Westford through our Chapter 115. Nice about that particular program is that even though we pay it through the town, the state reimburses us 75%. Okay. So it's really only a small factor for, I mean, we all pay taxes, whether it be to the state or to the local town. But so those are some of the numbers. We have about 750 veterans here in town. About 20% of those are women. The rest are men. Which is typical of the service. You know, there are, what did I just see here too, is that the largest age category right now is 70 to 79. Oh, wow. Our largest category of veterans. Our oldest veteran is 98, and our youngest is 22.
Oh, awesome.
Wow.
Yeah.
So that is amazing.
Based on the town census. Again, that's voluntarily providing information. The census, not everybody fills it out.
Of course.
But we try and track every veteran. And again, it's not a requirement. It's not like a dog license or anything. You don't have to register. It's strictly volunteer to announce themselves. We like to be able to track the veterans as well as, not track, be able to know that they're out there. Okay. I don't like to use the word track because we can all do that with our phones. But we have surviving spouses too, are a very important category to us, because sometimes after a spouse passes away, that their total income has been reduced because now they don't get both Social Securities, and sometimes those are challenges to get by on. So we have surviving spouses as a number, again, somebody that we can assist with. I had a daughter of a deceased veteran come in the other day and wanted to know, was she eligible for GI benefits? And in some cases, they are. So they are, even down to the children of a veteran, whether living or deceased, could have access to benefits. So it's something to explore. So those are some of the numbers. I will say that, you know, we talk about the veteran community is, here in Massachusetts, just under 7% of the total population have either served or are serving. And so it's not a big number. It got as high as 24% during World War II. Okay, it got real high after 9/11. So there was a lot of activity of people joining up because
how
they
about
wanted to
compared to the rest of the country?
Well, Massachusetts, all of New England is pretty low on the recruiting side.
Really?
I've talked to many recruiters, and they said their numbers are far less, their goals are far less than what the rest of the country. The biggest state that has the most veterans and active duty military is Texas. Second is California, Wyoming, Utah. But I will say that all of the New England states are in the bottom 40 to 50 states. So, and some of it has got to do with the educational opportunities. Which is a thing that is, I know we, our school systems encourage people to go to college, and it seems to be a big big push on that, or not push, but it's a big recognition. It's important to get your degree. But I will say that some of the best education I ever got was based on my military education. I mean, after I was in the service for almost 28 years, so there were educational opportunities abound. Anytime there was something new, I got to learn new technologies and explore stuff. So don't take the service for granted as a way to get an education.
Yeah.
We have a lot of, I know Eversource and National Grid will take people that are in the service, and it's called Helmets to Hard Hats program.
Yeah.
And they will take any veteran, almost no matter what their skills are, and make them into a linesman, a gasman, plumber, and they'll educate you and everything, help get your license. So there's some really interesting programs around the state. Again, this is some of the information we have at that office. So if you're looking for other employment opportunities.
Well, and I think the other, I know with the tax work program, that's a very small program.
You're a small program, but
I mean, when you talk about veterans and you look at their skills and their work ethic and their understanding, that really can't be matched. And so I could see how National Grid and the
Eversource, any of those,
that's very smart to provide that opportunity for employment. But that's another program that you all administer.
The property tax worker, we're doing our budgeting now, obviously.
You're just finishing up, or getting close to finishing up.
And so we've been funded for next year to provide, five veterans. And interesting enough on that program is that if a veteran is disabled and somebody wants to work on the benefit or the behalf of that veteran, they can do that. Our program in the veteran side allows us to work on the behalf of a disabled veteran to get them a property tax exemption or help with pay their property taxes. That's a really nice program too. We automatically double the basic property tax exemption at the state level for somebody at 10% or 10 to 90% is $400. Several years ago, the town voted to take the local option to double it. And what will be coming up, we think will be coming up on this next warrant, is to put a cost of living increase on that now. So where it was $800, it's going to go to $840 based on the cost of living. So that's the property tax work-off and disabled veterans and all that's.
Well, all of that's possible because of you.
Yeah.
And again,
truly.
Yeah.
Truly.
Just for
I'm the resource.
And
I'm the resource, and we.
I don't know if the resource is the right word to describe you, but we'll let it go. Yeah.
How about that?
Yeah.
But the town is just so fortunate to have you and your wife. Y'all both are so involved in the community and just do things quietly and just really say thank you for for what you've done in this position for the past 9 years, and I know you'll continue to follow.
Yeah.
And we're fortunate to have you on the board at the Cameron Senior Center.
Yeah, I started in 2010. I tell you, when my hire date was June 22nd in 2010. But so and I'm obviously on the Council of Aging,
Many boards.
and the Cemetery Commission, as well as Monuments and Memorials.
And Westford Remembers.
And Westford Remembers. I'm one of the
Radio Ham Club.
A lot of
Remembers. A charitable organization with the American Legion, and our American Legion post is who puts the flags out on the graves. So the town provides those. Again, that's 75% reimbursed. So we put them out about 2 weeks before Memorial Day, and then they come down after Wreaths Across America program in December, because we don't like the flags buried in the snow. But so we'll put flags at every. We have 1,400 veterans buried in our Westford cemeteries. The five public town-owned cemeteries and 2 privates. And 3 tombs. So we have personal tombs as well that we have will flag as well.
Well, Terry, we really appreciate you being with us today and continue to provide the wonderful service that you've been providing, and just glad to know you're part of this community.
Well, great. Well, thank you. I enjoy it. It's my town too. I love this.
It is your town.
It is your town.
Thank you.